Okay. Hey guys, so chapter 16, childbirth. I'm not even going to pretend like this is my specialty because it's not, but we're going to do it anyway. So, childbirth is normal. It's a natural part of life. Your part of the process involves helping, guiding, and supporting the newborn as it is born and being there for the mother as well. After birth, you should ensure newborn is breathing adequately and keep warm and dry. Two indications of an impending birth is those frequent contractions, which is contractions less than, I think it says 3 minutes, and crowning, which we're going to talk about both of those later on in this slideshow. So a little bit of anatomy. You ovaries, that's what produces the eggs. Eggs travel through the fallopian tubes to the uterus. The uterus, or the womb, holds those fertilized eggs as it develops during pregnancy. Developing newborn is called the fetus, is encased in amniotic fluid sac, or amniotic sac, I'm sorry, for support, and it floats in amniotic fluid. So that external opening is called the birth canal or the vagina. So right here we've got our uterus, which surrounds it. We have our placenta right here. Amniotic fluid is the fluid that baby just kind of floats in. Um, it protects it. Then we've got our urinary bladder down here, um, sacrum, rectum, and vagina. So, first stage. So, there's stages to this pregnancy. First stage, pregnant woman's body prepares for birth. Or I shouldn't say stages to pregnant, it's stages to labor. Um, the female's body will begin to prepare by itself. And like I've said in previous chapters, our body's this amazing thing that can like do things by itself. These are characterized in conditions like internal contractions occur, bag of water breaks, or the water breaks, bloody show occurs, and then the newborn's head does not appear during contractions. So this is step one. The female body begins to prepare for birth. The second stage, birth of the newborn. You'll see the newborn's head crowning during contractions. That's where just the top of the head begins to show in that vaginal opening. There is no time for transport. Once we begin to see the crowning, we're probably delivering. So we need to have our OB kit out. We need to have sterile towels, rags, dressings, what you have available. Definitely need our gloves, maybe even glasses for this. Um, just be prepared because you're dealing with mom and baby. So stage two is the head begins to crown during contractions. Stage three, uh, stage two, we are giving birth. So we start with crowning, we deliver the baby, and then stage three is when that placenta is delivered. Um, you must assist in stabilizing condition of the mother and newborn and delivering placenta. Placenta is going to be about 10, 15 minutes later. Don't ever pull it, don't rush it. It's attached to that cord. Um, it needs to work its way out on its own. Remember, I'm big on verbalizing with our patients, talking to our patients, educating our patients. So the more you know about this, the better you can educate that mother, and you can try your best to keep her calm and comfortable and take care of the baby. Um, is there time to reach a hospital? So the things we kind of need to know that play a role in this is this woman's first pregnancy? The first one, it might take a little bit longer for everything to take place and work. and I don't mean to be rude here, but everything's going to stretch out. Um, so a woman experiences her first labor will usually have more time to reach the hospital. Has a woman experienced bloody show yet? Has the water broke? The water usually breaks towards the end of the first stage of labor. That's when that body is preparing to deliver. We're in the first stages. The water breaks. We know we're starting. There's no turning back at that point. How frequent are the contractions? So contractions less than 2 minutes apart usually indicate that delivery will occur very soon. So I think I said 3 minutes earlier, so it's 2 minutes. We're getting those contractions at 2 minutes or shorter. Our water's broke. We're probably delivering a kid. Um, does a woman feel an urge to move her bowels? When a newborn's head is in the birth canal, it presses against the rectum. Do not let her go to the toilet. They're going to argue, they're going to fight with you. Do not allow them to do it. That indicates and says that that baby is moving down that birth canal and we're fixing to deliver. Is a newborn's head crowned? Are we seeing the top of that head in the vaginal opening? Is transportation available? Is an ambulance responding? How far is it to the hospital? Will bad weather, natural disaster, traffic prevent prompt arrival of transportation? So these are factors we need to take into account as an EMR. Uh, do you have help coming? How long is it going to take? And then where's the nearest hospital capable of delivering this child? So most appropriate facility. So those contractions, this has always confused me. So I'm going to try to explain it so I don't confuse more people. The time contraction cycles from beginning of one contraction to the beginning of the next. If the contractions are less than 3 minutes apart, delivery is close. So from the start of a contraction to the start of the next one, that's the time we're looking at. It's not start to end, which is how I always thought it was, and I was wrong. It's start to start. Um, if it's 3 minutes or less, we better be getting ready. Observe the vaginal opening during a contraction. Um, if you see the head crowning during contraction, prepare for delivery. Do not risk transporting the woman to the hospital. If that head is showing, we're delivering within minutes. We don't have time. We're loading, putting on an ambulance, and transporting. We are delivering probably within the next couple minutes. As you prepare to assist a patient in delivery, keep two things in mind. Calm woman delivers a natural process. Calm yourself. You are there to help. And we've talked about this in previous chapters where this is not your emergency. You stay calm. You educate. You be there for that patient, that mother. You might have to educate and be there for that dad too. So your aura, if you will, your demeanor will actually play off on your patients. So educate the mom, be there for her, listen to her. If she wants to cuss, scream, and gripe, let her. You're there for them, not your emergency. You will not be able to maintain sterile conditions. So attempt to be as clean as possible. Wash your hands thoroughly. If you do not have sterile delivery kit or an OB kit, use gloves from your EMR, life support kit, first aid kits. Have plenty of clean towels ready. If you're doing this in someone's house, if you're the first responder, you might send dad or a kid or somebody after every towel they have in the house. Get warm water. Um, get blankets, sheets, whatever you think you might need. So place the patient on a firm surface that is padded with blankets, folded sheets, or towels. Elevate the woman's hips 2 to 4 inches with pillows and blankets. This will kind of align a little bit better, that birth canal. Place that woman on her back with her knees bent and feet flat on the surface beneath her. A woman in childbirth will expel both blood and body fluids, so be prepared for that. Use sterile gloves whenever possible. Follow the steps in your book. It's 16:1 to put on sterile gloves. Wear face and eye protection because there is fluid. It will be splashing possibly. Wear a surgical gown if you have it to keep those fluids off your body. So some of the equipment we can be looking at is your emergency care equipment should include a pre-packed, it's an OB kit, um, sterile gloves, the umbilical cord clamps, sterile drapes and towels, sanitary pads, 4x4 gauze, towels or blankets for the newborn, bulb syringe, plastic placenta bag, because we're going to transport that placenta with us, with mom and baby. You will also need sheets or towels for the mom, suction if available, oxygen if available, newborn size face mask if at all possible. If you do not have a delivery kit, look for appropriate substitute material. And that's what I was saying a little bit ago. If you're in someone's house, go ahead and get every towel in the house. Grab some sheets, grab some blankets, a pillow, whatever we need. That we think we might need. If we think we need it, go ahead and have it grabbed. Assisting with delivery. There's two lives to be considered: life of the mother and life of the newborn. Do not neglect to perform a patient assessment on the woman. Your primary purpose is to assist in delivery of the newborn. Be as clean as possible during the entire delivery process. This is going to be really hard. We still do an assessment. We still get vitals. We still get a history. We still do our assessment. Newborn's head should emerge slowly to prevent undue stress on the newborn and tearing of vaginal tissue. As the head emerges, support the newborn's head and tell woman to stop pushing. Do not attempt to pull the newborn during delivery. Don't try to speed this up. This is a natural process that needs to be as natural as possible. We're there to catch and support. That's what we do. In normal birth, newborn will turn to its side by itself after the head emerges. The rest of the body will be delivered spontaneously. The newborn will be wet and slippery. Keep newborn's head at about the level of the woman's vagina. So here we've got A, B, C, D. So A, we've got that crowning. B, this person just supporting that head. C, the baby has actually turned to its side, and we are still just supporting the head. We're not pulling, we're just supporting. And then in D, it looks like them shoulders are starting to come out. Once we get the shoulders out, I think it's pretty simple from there. I say simple, and I don't mean to offend anyone. I think it's a lot simpler from there for that child to come on out. If amniotic sac has not broken, tear it with your fingers and push it away from the newborn's head and mouth. If the umbilical cord is wrapped around the neck, attempt to slip it over the head. If you cannot disentangle the newborn, attempt to reduce pressure on the cord. Never pull on the umbilical cord. So we can actually go in there, and I don't have my mannequin with me, but you can go in and you can actually use two fingers and keep that umbilical cord off the neck. You can keep it like away from the face, so this is all open. Don't pull the cord. Don't try to force it over the head. This is a gentle process. Clear newborn's mouth and nose using a bulb syringe if one's available. Suction mouth first. That is a test question, by the way. So we suction the mouth first and then nostrils 2 to 3 times until they are clear. If a bulb suction is not available, Wipe the mouth and nose with gauze pads. Try to get as much junk as we can. Place newborn on mother's abdomen to keep newborn from losing warmth. At this point, we can throw a blanket on mom and baby. So they're suctioning. You see how wet and slimy this thing is. Be prepared for that. This isn't a pretty process. If the newborn is breathing, suction the mouth and nose again. If the newborn is not breathing, suction the mouth and nose again. Rub newborn's back and flick the soles of its feet to stimulate breathing. It's almost like sending it into a little shock effect, just that moment. Use a towel to dry the newborn and wrap him or her in a blanket to keep him or her warm. Place the newborn on its side with the head slightly lower than the trunk. When umbilical cord stops pulsating, then we can clamp it with an umbilical cord clamp and tie with gauze if you don't have the clamps. Note time of delivery. If there are multiple births, prepare for the second delivery. So you're going to wrap that baby up, you're going to hand it to mom, and you're going to prepare for that next one, which is not a sign of a normal birth. Multiple births is perfectly normal. It's part of the natural process. So it is not something we look at as a problem. Placenta usually delivers on its own within 30 minutes. I said 15 earlier, but 30 minutes after delivery. Never pull the cord. Once again, leave umbilical cord uncut and attach the placenta and newborn until EMS units arrive. So I'm not sure if EMTs can. I think they can. They can cut cords. Advanced and paramedics can cut the cord. Hopefully I see you guys in EMT and we'll discuss it then. So after that placenta is delivered, we got the baby out, the baby's breathing, we're wrapped up staying warm. That wrap it in a towel or newspaper with 3/4 of the umbilical cord showing. Place it in a plastic bag and transport it to the hospital. Keep it at same level as the newborn. So that placenta is actually feeding, has been feeding and giving that baby nutrition. The blood supply that came from mom goes through that placenta. So we want to make sure that we are still delivering everything we possibly can to that child until we get to the hospital. Mother's bleeding usually stops after placenta delivers. If it does not, massage the uterus. So we're going to place one hand just above the mother's pubic bone. Use your other hand to press down into the abdomen and use a circular motion and massage that uterus until it becomes firm. This should take 3 to 5 minutes. It might be somewhat uncomfortable. Once again, we educate the mother as we're doing this. So aftercare of mother and newborn. So continue to observe mother and newborn and keep both warm. About every 3 to 5 minutes, check uterus for firmness, recheck vagina for any excessive bleeding. In a normal delivery, mother will lose 300 to 500 milliliters. That's 1 to 2 cups of blood. That's quite a bit of blood. Don't get tunnel vision on this. It's going to look like a lot. It's going to seem terrible. Just we're going to pay attention to it. We're going to continue to monitor, and we're going to do our assessments on mom. We're going to watch our blood pressures. We're going to watch our respiratory rate. We're going to watch that airway. If the bleeding continues, we can continue to massage that uterus. If it is not firm or if bleeding continues, clean mother with clean, moist towels and cloths. Give her small amounts of water to drink if she's thirsty. We kind of talked about this in controlling severe bleeds a few chapters ago. We're not going to insert anything into that vaginal cavity. We're actually going to take like an abdominal pad. If the bleeding continues, we're massaging. We can hold that abdominal pad at the opening and just do light direct pressure. on the vagina, and that's how we control bleeding there. So massage the uterus and hold an abdominal pad right up against that opening. If the newborn does not breathe on its own within the first minute after birth, proceed with steps listed in 16.2. So I'm guessing we're going to start probably CPR. I don't have my book with me, and we're going to give rescue breaths and CPR as needed. Um, atopic pregnancy and shock in pregnant women. So, an atopic pregnancy occurs when a fertilized egg becomes implanted in the fallopian tubes rather than the uterus. And what can happen here is that egg begins to grow and fertilize, and it can actually rupture that fallopian tube. As the embryo starts to grow, it expands and causes fallopian tube rupture. I guess if I read everything before I talked, it would help. So that atopic pregnancy and shock. Again, this rupture causes acute abdominal pain, internal bleeding, and shock. Treat the patient for shock, arrange for prompt transport. So if you just run on someone, they might not even know they're pregnant. They're having that extreme abdominal pain. Look for signs of internal bleeding, and they're in shock for no particular reason. It's perfectly normal during an assessment of an age-appropriate person to ask, are you sexually active? Is there a chance you're pregnant? And if we're seeing these signs, that's what we're going to treat for. We're going to treat for shock, right? So internal bleeding, we can look for rigidity, discolorization. Are you BM have blood in it? Are you vomiting blood? How long has this been going on? These are very, these can be very serious situations. So miscarriage and vaginal bleeding, a miscarriage or spontaneous abortion is delivery of an incomplete or underdeveloped fetus. If a miscarriage occurs, save the fetus and all tissue that passes the vagina, control woman's bleeding, and treat for shock, arrange for prompt transport. If you guys haven't figured it out yet, we're going to treat for shock all the time. And I'm going to be a broken record. Make sure they're laid down. We're going to flood them with oxygen, 15 liters non-rebreather, and we're going to cover them up to maintain body heat. So every one of these we're treating for shock. Just want to point that out again. Vaginal bleeding is often the first sign of a miscarriage. When a woman experiences vaginal bleeding, perform a patient assessment, obtain a good medical history, get a set of vitals, arrange for that prompt transport, and provide emotional support if she miscarried. We don't know for sure. Sometimes we do, but one of the big things we got to do here is we have got to be supportive of this mother. This is probably the most traumatic day of her life. So we have got to be supportive. We don't say things like miscarriage just because we're guessing. We can ask, are you possibly pregnant? If she knew she was pregnant and she's the one saying, I think I miscarried or I did miscarriage, the best thing we can do is do our job and be empathetic. Premature birth, any newborn weighing less than 5 pounds or 2 kilograms or delivered before 36 weeks is premature. Premature newborns are smaller, thinner, and usually redder than full-term newborns. Keep the premature newborns warm because they lose heat rapidly. Their skin is thin. They're not fully developed. We've got to keep them warm, wrap them in a blanket, put them against mom's chest. And then once again, arrange for prompt transport. Unbroken bag of water or the water has not broke. Carefully break bag and push it away from the nose and mouth of the newborn so they can breathe. Be careful not to injure the newborn in the process. This, like I said, this is very delicate. We don't just go in there and start grabbing and trying to break things. Suction that newborn's nose and, the mouth and then the nose to help him or her breathe. So we're going to do the mouth, then the nose, both sides. Okay, prolapse of an umbilical cord. So the cord may be compressed between the newborn and the woman's pelvis during contractions. Place pregnant patient in a position that raises her hips, which we're going to do that like 2 to 4 inches. Keep cord covered and moist, and do not try to push back in the vagina. So the cord comes out first. We elevate those hips so we're kind of in line. We want to put something moist over that. We never push anything back in. Administer oxygen. So we're going to treat for shock. Arrange for prompt transport. Some EMS systems recommend placing a woman in a kneeling position to take pressure off the cord. Breech birth, so the newborn's butt cheeks come down the birth canal first rather than the head. Arrange for prompt transport. Support the newborn's buttocks and legs as they are delivered. Head usually follows on its own. This can be a little bit scary because it's a little bit different. It's kind of a complication, but it's doable. If the head does not deliver within 3 minutes, arrange for prompt transport. Insert a gloved hand into the vagina and use your fingers to keep the newborn's airway open. In very rare cases, arm or leg, first part of the newborn that appears in the birth canal, limb presentation cannot be handled in the field. We are getting to a hospital right now. So I was talking about earlier, you can go in there and you can like use your fingers and you go kind of around the mouth and nose, and you can just keep that airway open. You're keeping everything away from blocking the airway. Stillborn delivery. Sometimes a newborn dies in the uterus before labor. Fetus will generally have an unpleasant odor and will not exhibit signs of life. Carefully wrap the stillborn newborn in a blanket. Turn your attention to the mother. Provide physical care and emotional support. Multiple births. These are not actually considered complications. I hate that it put it under the complication area. Another set of labor complications will be begin shortly after delivery of the first newborn. Get ready to repeat the procedure you completed for delivery in the first newborn. Excessive bleeding after delivery, so approximately 1 to 2 cups of blood is lost during childbirth. So complication, multiple birth is natural. And I'm telling you that because I've seen the test, I've seen the quizzes. Multiple births are not considered a complication. Inconvenience, maybe. Complication, no, especially if they're both normal births. So excessive bleeding after the delivery. If the mother is bleeding severely, place 1 or more clean sanitary pads at the opening of the vagina, which we talked about. Elevate those legs and hips. Treat her for shock. Arrange for rapid transport. So we're going to cover that opening. We're not going in. We're not plugging anything. We're not doing any of that. We are literally covering that hole with, I like abdominal pads because they absorb more and I can stack them up a lot better. Excessive bleeding after delivery. Encourage newborn to nurse at mother's breast. Massage the uterus with your hand. If area between mother's vagina and the anus is torn and bleeding, treat it as you would an open wound. So this does happen, especially on a lot of your first-time mothers. You will get a tear, and we have to treat that. Woman should be examined by a physician. So focus and involved in even a minor crash. Okay, sorry, vehicle collision with pregnant women. I got lost for a minute. So if there's even a minor crash and the woman's pregnant, she needs to go see a doctor. Promptly assess that patient and arrange for transport to the hospital. Even if they're like, oh, I'm fine. If they tell you they're pregnant or there's a chance they're pregnant, they need to go to a physician. If a woman exhibits signs of shock, monitor the airway, breathing, circulation. So there's our ABCs. Arrange for administration of high flow oxygen, so non-rebreather at 15. And have the woman lie on her left side rather than her back, and put a blanket on her. Maintain that body heat. In rare cases, a crash can be severe enough to kill pregnant women, but not the fetus. So we still provide CPR to the woman while transporting her to the closest medical facility. Not only are we trying to save our woman, but at the same time, if we are pumping her heart, we're still supplying blood flow to the baby. Um, for some people, that's really hard to understand. If mom's heart is beating, baby's being fed. If mom's heart's not beating, baby's not being fed. Um, so even if she is, we're trying to save mom, but we're also keeping baby alive. So I think that went somewhat smoothly, better than I was expecting, honestly. Uh, so for the EMR, assisting with deliveries involves, okay, so I'm going to say C, supporting the newborn's head as it emerges and telling the woman to stop pushing. As soon as the baby is born, it is important to, so we don't want to cool the baby. Um, sure the baby is dried and warm. Keep newborn's head higher than its body, and then immediately cut the umbilical cord. I'm gonna go with B. It's pretty important that we get them dry and warm. And then this is the one I really wanted to show you guys. Complications of pregnancy include all of the following except D is the answer. Multiple births is not a complication. That's why I hit on that so much in the video. But one other thing I want to show you, and I need to be better about this on our quizzes, is how you read these test and quiz questions. So that word right there is huge. So this is when we read a question multiple times. So complications of pregnancy include all of the following, except, well, premature is a complication, prolapse is a complication, breech is a complication, and I said multiple times that multiple birth is not a complication. Multiple birth is not a complication. So, guys, that was childbirth. I'm not an expert at it. I hope you got something out of this video, and I will see you on the next one.